Hi, my name is Farah Mafra.
And my name's Beth Parker.
We are currently housemates and we are both occupational therapists. We met doing occupational therapy at YSJ and now we live together.
So I chose occupational therapy because a lot of my grandparents had occupational therapists after becoming ill and reduced mobility, and so I discovered the career from them and just discovered that I thought it was a fantastic career. And then I chose YSJ because I came for an interview day and I just felt right at home. It's a really lovely campus, and I could see myself at York St John, whereas I'd had previous interviews at different places but it didn't quite feel right for me.
And I chose occupational therapy just from my own personal experience. So I had a knee dislocation and I required therapy, and through that I discovered occupational therapy, and upon further research I found it to be fascinating. And since then, since I was 15 years old, I've wanted to be an occupational therapist, and I came to England to do that, and I have thankfully succeeded. Why YSJ? Same as Beth said, the campus and the area spoke to me. It just felt very homey. It is small, but it is a very tight-knit community. It's a very lovely campus in the middle of town, and you have the city centre across, and it's just really lovely, and all the staff and all the other students are really nice, and it's a very cosy environment to be in. I work in a medium secure forensic hospital, so it's a specialist environment for individuals that require medium secure and maximum therapeutic interventions. So my patient group is currently individuals with learned developmental difficulties such as autism and learning disabilities. A typical day in my life as an OT includes coming in at 8:30. I do my handover of the previous day and night for our technical instructors and our other occupational therapists, because we are a 8-ward hospital. Following that, I go into my ward round, which with the multidisciplinary team, which includes psychologist, social worker, the ward manager, consultant, nurse, and the patient, and myself. And each week we have that, and we go through a certain amount of patient groups. Following that, I head on to the ward. I speak to a few of my patients, I carry out a few interventions, and I follow through with some referrals to, for example, jobs that we have within the hospital, or activities in the community that the patients can attend. Our hospital has now finally opened up from COVID-19, so we are able to experience more, and the patients are able to have higher therapeutic interventions and they're able to enjoy themselves more and engage in things that are more meaningful to them.
That's me. Okay. And I work at York Hospital now, and I'm on one of the admissions wards, or on the admission wards, and I mainly do a lot of discharges, or see for people that are therapy fit for discharge, make sure that everything kind of supports in place for them to go home. Kind of, if not, then what we can do to support that, potentially refer them to rehab, or kind of support them with a community team to make sure that they can go home safely. And so my day-to-day kind of go in, have a handover with the multidisciplinary team, see which kind of patients are prioritised, see those first, and then work through order of prioritisation. So first we go for kind of discharges and see who's medically fit to go home today, whether we can sort that out, what we need to do, and do that. It's a very fast-paced environment on the admissions wards, so I see a lot of people every day. But yeah, my main role is to just make sure people get home or go to the ward that they need to with therapy input.
Yeah, I think it's important to also know that even though we're both occupational therapists, we're both on different ends of the spectrum. Beth is on the physical side, and it's lots of transferring, mobilising, hoisting physical aspect of OT, whereas I'm on the mental health side, and I don't really carry out as many or anywhere near the physical aspects of it. So it's more around engaging my patients in meaningful activities, optimizing their life skills. If they are moving on to the community, making sure that they are fit and feel independent in themselves to take care of themselves, and just getting them ready for whatever chapter is next in their life. And there is a big difference, but they are both as important as each other. And I find my role to be very rewarding because it's not as fast paced as Beth in terms of she has new patients every day. Mine's more long term, so I work with the same patient group for months and months, maybe even years on end, just trying to help them get to their optimum self.
I think you're